Okay, good morning, everyone. This is Phil Pugh. We're going to go ahead and get started with our monthly coalition meeting. Hopefully, everyone's had a good weekend and this Wednesday greets you kind of well. So let's go ahead and get started with our roll call here in a sec. Just as a reminder, a little administrative point, if you are calling in or on your computer, please make sure that you're muted so we don't hear a lot of background noises just in case someone is talking, so they're heard clearly and they're recorded clearly. This will be recorded. Again, if you do not wish to be recorded, please jump off now. We will upload the video to our YouTube page for digestion later. Okay. If you do have to jump off the call, please remember, don't hit hold. You can either just, again, stay on mute, but please don't hit hold. Just another quickly reminder for you folks out there about make sure you have a Siren account and make sure it's up to date. That's where we get all the good information from the state when they push it out and as soon as possible. So make sure you have that. Also, Illinois Helps account. If you do not have one, please do so. And if you have folks that want to register to be volunteers for the Illinois Helps program, great place to do it. I know we had some struggles through COVID of using the system, but we want to make sure it's still there. And once we've knocked out all the, whatever issues that we may have, we can use it to its fullest extent. And if you haven't conducted a resource request drill through your local health department, your hospital entity, please set up something with your local health departments to make sure that you are familiar with the process. You can always take a look at the process inside of our EOP as we have it outlined, and it mirrors the state's process. Okay, we'll go ahead and start with our roll call. Start with our hospitals. We'll start with Anderson.
Eric's here.
Got you, Eric. Thank you. Alton Memorial.
Hey, good morning, Philip. It's Brian from Alton.
Thank you, Brian. Boyd. Don't think we got Nancy on. I don't see her, but maybe she'll join shortly. Carlinville Area Hospital. How about Staunton?
This is Sue. I'm here.
I see you, Sue. Thank you. Fayette. Gateway.
Danielle's on.
Thank you, Danielle. Our HSHS partner, starting with Holy Family. St. E's. St. Joseph Breeze.
Hi, Margie Berry's here for St. Joseph Breeze.
Gotcha, Margie. Thank you. And Highland. How about Jersey? And from Memorial Hospital Belleville, I've got myself, Lee, Eric, Mike Gilbert. We are all on. Scott, I see Scott did call in, so I see you there, Scott. Got you as well. Chester.
This is Georgia. I'm here.
Got you, Georgia. Thank you. OSF St. Anthony's.
Gary's here.
Thank you, Gary. And Redbud.
They're on here.
Gotcha, Tara. How about Sparta?
Dan's here, Phil.
Thank you, Dan. And Touche. Do not see Amy. Okay. Bond County Health Department.
Yeah, Terry, I'm here.
Gotcha, Terry. Calhoun. About Clinton. Eastside Health District. I got you, Charmaine. I see you. Thank you. Oh, where are we at? Fayette. Greene County. Jersey. And Macoupin County.
Eric here, Phil.
Got you. Thank you very much. How about Madison?
Michelle's here.
Thank you, Michelle. Monroe County.
Vicky's here.
Thanks, Vicky. Randolph County. And St. Clair County.
Kara's here.
Oh, Kara, thank you very much. Gotcha. Our community partners and IDPH, we'll start with Greg for RMSC. You on?
I am on.
Thanks, sir. Is Beth on today?
Beth is not back yet.
Okay, no problem. Any of our BJC partners on today? Our emergency management agency folks. Don't all shout out at once. I know we got a few of you on.
This is Keith Norman. I've taken over for Larry Mears in Jersey County.
Jersey, welcome, Keith. Thank you very much. Are you signed up on the Member Planet site at all?
I am not.
Okay, so I'm gonna Lee, if you can, while I'm going through this, can you put a link in the chat for Keith to click on so he can go ahead and register there. We'll get you taken care of. Thank you, Keith, and welcome. Any other EMAs? St. Clair County, are you on? And Madison County, by chance? All right, we'll go to some of our EMS services. I saw John Nowak from MedStar. John, you still on?
Yes, sir. I'm trying to toggle between 3 meetings, but I'm with you, sir.
As always. All right. Our friends over at Abbott.
Leslie's on.
Thank you, Leslie. SLU Hospital. No Helen today. Scott Air Force Base. Any of our Scott Air Force Base partners? Just spoke with Tim yesterday. I'm not sure if he's on today. Don't see him. And our STARS partners.
Good morning, Phil. This is Dale.
Thank you, Dale. I appreciate it. Good morning. Anyone I did not get that we want to, so we can, that anyone didn't sound off so we can get you captured on the meeting minutes?
This is Ashley Hilsman with Residential Hospice.
Thank you, Ashley.
Morning, Phil. This is Denny with St. Anthony's in Alton.
Okay, gotcha, Denny. Thank you very much. Anyone else? Once, twice, thrice. 3 Mississippis, and we're off. All right. Again, welcome to our monthly. This hopefully should be a short meeting today, and we'll have a lot more for our quarterly meeting next month, our last of the year, our final of the year. Hopefully a historical perspective and a few due outs that we can catch up on that we'll talk about today that we have as a coalition specifically. So here's our agenda. It's pretty much our standing agenda. This was last month's kind of, if people call it the epi curve, but this is our hospitalizations curve. This was the October. Well, actually, this is actually the September curve. But this is what we briefed in October, and this is what we're briefing in November, and you can kind of see the difference. We have been on a steady decline with hospitalizations, which is great. There has been a slight uptick in some of the hospitals north of here, and some of my peers, as far as RHCCs go, have been reporting on not a ton of supply or equipment requests or outstanding things very similar to what we're doing here, but their numbers are going up just slightly over the past 2 to 3 weeks, but nothing's at an alarming rate, but we still continue to decline, which is good. These are our patient expirations as we've had. So as you can kind of see through the month of October, we've dropped back down. We did kind of peak up there in the month of September with 1.63 patients expiring in a hospital setting per day. Now we're down back to 1.32. Hopefully we will maintain that downward trend and along with the hospitalization. So hopefully we'll see good numbers next month. Vaccine data, this is where we're at now as a region. We're around 46.37% fully vaccinated. We made some more progress. About 57,000 more folks are vaccinated across our region than last month. Or excuse me, 57,000 administrations have been given, and we're about 12,000 more than we were last month, about a 2.6% increase month over month. I think last month we were a little less than 2% increase. So that's good. Hopefully we can still get some of that uptake. I'm not sure how the numbers on the back end will change with the expansion of the 5 through 11-year-olds being able to be vaccinated. I know you probably saw the siren that went out yesterday or this morning regarding that. So I'm sure those numbers will potentially start to creep back up even further. So any questions on any of the vaccine data or the hospitalizations? No? Okay. If not, we will start out with Greg. Any notes from IDPH, Greg?
Good morning, everyone. Really not. I mean, HPP, Phil, we're on the same meetings together, so I will let you share that information. As you said, the vaccine for 5 to 11-year-olds will be rolling out. I'm not sure how much that will impact the hospitals as a whole, but of course, some of you have pediatric offices, and I believe that there are people reaching out to those pediatric offices about those vaccines. But just always remember your local health departments, they're your content experts. They're the ones who know everything. So please make sure that you reach out to them if you have questions. I do expect Beth will be back very soon. The health departments know that Kevin in Region 5 is covering for Beth while she's been out. So make sure to reach out to him. But if you have any issues, please, for the health departments, well, everybody, but the health departments in particular while Beth's out, please feel free to reach out to me if you have difficulty reaching Kevin, and I will try to get any answers for you. One other thing, I wanted to make a reminder to the EMS today on our EMS call, and I see there's several on today, that there was an email siren notice that went out. And if you're having difficulty getting testing supplies, there is a way for EMS to request that from IDPH. So just wanted to make that announcement if anybody is having difficulty getting it through their normal channels. And that's all I have, Phil.
All right. Thank you, Greg. Okay. Any questions for Greg? Okay. All right. We will skip I'll just say any public health announcements. I know Beth's not on, but any public health announcements from the team that they'd like to share with the group? Okay. No public health announcements. We'll move over to STARS. Dale.
Not a whole lot. Our graphs look a lot like yours. There seems to be, in this morning's state report, there seems to be a little leveling off on that downward decline of cases. Looks like particularly around the 18 to 24 range. Seems to be a slight increase over the last week or so. Not enough to raise any alarms, but enough to notice. That was from the state. Locally, again, things are looking good. Hospitalizations, unfortunately, are pretty stable. It's we're still full, like a lot of folks are, not necessarily due to COVID. So that's an ongoing concern as we move forward, but manageable. But other than that, I think very reflective of what all's happening over on your side of the river as well. Appreciate it.
Awesome. Thank you, Dale. Any questions for Dale? Okay, no questions. We'll move on. Remer, Mike, would you like to give any updates?
We kind of finished up our busy part of the year with all the events that we help out with. And we're kind of trying to get reorganized and get our supplies back in order, and looking at setting up training for both ICS classes and other TCCC and TECC classes that we're going to try to be pushing out next year. So.
That's Mike, did you want to talk any about the tornado response a little bit? I don't know if he jumped off, but for those,
I'm here.
okay.
Sorry.
No problem. Did you want, go ahead.
So we during the tornadoes, we got notified and had some responses of the potential of having to do evacuations. So we kind of did some lessons learned on our side here at the hospital as far as the notifications and how they should go and getting roll calls done, the regional roll call with bed counts available to see where we can send these people. And so we've Phil, Eric, Lee, and I have all kind of stepped back and looked at how our response from a resource hospital and from the RHCC side looked, and are working on some education, and sounds like we've got some buy-in with wanting to do further exercises on how that roll call happens and how that communication gets pushed out to all of our partner hospitals within the region. So, Phil, did you have anything else you wanted to talk about?
Well, I will say this. Thank you to the folks that did quickly and immediately respond to the bed query that night. So I think we're somewhere between 9:30 and 10 p.m. on was that Sunday? Saturday or Sunday?
Yeah, Sunday. And yes, Phil, you are very right, because the first thing I did was fired up the EM resource to see if that took place. And to be able to see that being populated, it made me feel much better knowing that we had some availability. Because at first, when you hear a nursing home hit, you're thinking the worst. So we didn't know what we had. We were very lucky and fortunate, but I guess maybe that was you that pushed that out. But I'm telling you that it's wonderful to be able to see that and know that we had this availability close. And as we start coming up out of the south, what our availability was. So that was wonderful for you doing that, and for all the hospitals that participated and put those numbers in for us. So that was good.
Indeed. And yeah, I was after Lee and I talked, I think I was actually traveling at the time. Lee's the one that pushed it out after that. I mean, it's just kind of it's kind of our first step when it comes to any disaster. So, when you hear the EMS crews that, what John is relaying, that information is vital especially during the initial stages, just to know that there's space available, because no one knows exactly what's going on at the time until they go look, so keeping your ED statuses up to date is vitally important as well. So in case you were experiencing a surge or a peak census, that would be great information to have in there before that call even came out. So these are things that I would ask all the hospitals to kind of go back and refresh. So we had some folks that immediately updated. I like to say, I think Lee pointed out that St. E's, maybe Brad was looking right at it. As soon as he got it, he went through whatever his protocols are at St. E's, and he updated his very rapidly, which was great. But other folks did it in a fairly timely manner. Some folks missed it completely, or I'll say at least one of our hospitals at Memorial missed it completely. But some folks got it a little late, or got to the information or updating that information a little late. So what I can say is that the information is great. I would just say let's work on our timeliness of getting that information back out to meet the need of the first responders, so our EMS crews can actually have situational awareness of what's going on. Kind of thought about sending it over through, because we do have the capability to send it over through on the St. Louis side, but kind of shied away from that for this one because we had a lot of conflicting information. I know I reached out to the next day to Georgia to make sure, just to kind of confirm what we kind of knew. We were on the Styx COP that night, so there was some back and forth information going on. The roof was blown off, the fire department was destroyed and missing, yada yada. All things that kind of turned out to be not true, obviously. But that's the fog of war. You're going to have a lot of misinformation early on. But it was great. We had folks on the ground that could tell us what they see, what they saw, and then, kind of big to do about nothing, but it was a great exercise in doing it, completely off the cuff. And as I tell everyone with EM Resource or your EDs, the accident is not the big major thing is never going to happen at 9 a.m. on a Monday. Everybody's here. It's going to happen on the off hours. It's going to happen in the dark, and it's going to be confusing to start. So thank you to everyone who did participate in that, and hopefully we'll get even better at it. I think we're going to go ahead and write up a small after actions report on it. It'll be basically be about the communications there and where we can grow, and we'll post that and send it out to everyone once we get that done. But very small after actions on it, most of what you just heard here. So we'll go ahead and move on.
Hey, Phil.
Yes.
Hey,
Great.
I just wanted to remind all the hospitals, I think most of you or a lot of you sit on your emergency operations committees, and that I want to remind everybody that EM Resource has the ability to notify you. You can go in to EM Resource, and when these types of alerts are done, you can have it text, you can have it emailed, you can even have it sent to a pager if you need to. And I think that's really important for everybody. You can even set up what times that you get those alerts. So if you only are on the day shift, you can set it up for the day shift. It'd be great if your night charges were on that notification so that they got that. So when you go back to those meetings that you go to, because I know many of you aren't directly involved with updating those bed numbers, but make sure that you share that ability of EM Resource to send out those notifications to you when something like this happens.
Great observations. There are, yes, plenty of options under those notification preferences. So please make sure you're signed up for those. So you're getting them via text, email, etc. So perfect. All right, let's go on. Sue, anything from mental health side?
No, I don't have anything for mental health. I'm sorry.
No worries, no worries.
Hey, Phil, this is Mike.
Yes, go ahead, Mike.
CISM class for both group and individuals is the 15th of this month. Currently, I think Lee just told me that we have 13 out of the 20 slots filled.
Great, and I know that's posted out there for registration, and we're working the payment side of it. Where's it located again, Mike? Where are we doing it?
It's virtual.
Okay, all online. So you have a great opportunity for some good training there with at least 6 or 7 slots still open. Eric, I see your hand up.
Yeah, Phil, I had a comment about the previous topic before you went to Sue and then talked to Mike. So I didn't hop in quick enough. So as far as the after action on that, I personally would love it if and maybe you do this, but you let if the hospitals can know if you know that their hospital didn't report. That would probably be helpful. I know I would because as much as I try and stay on top of it 24/7, sometimes you miss things. And if you guys catch something, I have absolutely no angst in somebody like you calling me or emailing me saying, your hospital really stank it up on this one. And I know you wouldn't say that, but something a lot more PC and just calling it to their attention. That's all.
Not a problem. We'll do. So yeah, this should be fairly easy. We do have the data on that, and it's something easy we can pull back from EM Resource so we can have the exact kind of timestamps, if you will. So we'll do. All right, Eric, any pediatric information? per him.
No, I got you, Phil.
Mhm.
I know the other Eric.
Then we'll go
makes
from one
it,
Eric to the next. Sorry.
exactly. He's a good act to follow. So a couple of things on the pediatrics. Greg alluded to one of them, which is that the Pfizer shot for 5 to 11 has been, for the 5 to 11 age groups have been approved. So, it's in a lower dose, not the same as the adult dose, but it is out there for the, for those age groups in the pediatric community. Working with, still trying to get some feedback from HSHS because the Brad Gadding, who is a nurse who's been running the EMSC for the region, hasn't had a meeting in a little while, and I'm trying to figure out what's going on with that so we can kind of partner up with the preparedness as well as the other updates that he provides to get some information out to the region, because right now there are some, at least on the preparedness side, there's a pediatric and neonatal disaster surge guide that's in its final draft. And there's also a course development for the school nurse emergency care course that is being put together. And so there's a lot of things and some additional guidelines that are also being drafted. So I'm trying to marry up efforts with HSHS on this and trying to get some more information out to the region at one time versus piecemeal on it. So that's kind of where pediatrics stands right now, and coalition wise. That's all I got, Phil.
Thank you, Eric. No problem. Any questions for Eric? Okay, moving on. As always, a quick plug here for EDAP. If you're not EDAP certified, I can't remember exactly who's not right now, because I know we got some folks going back to being EDAP certified. But if you're not, opportunity's always there. If you ever have any questions about it, Eric or myself can help you. Obviously, Greg can, and we can obviously have Anna Sherry brief. Again, we're looking to have her provide some form of brief, potentially at our quarterly meeting next month. So stay tuned. All right, quick grant status update. Not a lot of changes, but the deadline has passed for the NCE for the no-cost extension for those who had a no-cost extension through 31 October. That has expired. So all your purchases should have occurred before that time frame, and you should have invoices, purchase orders, etc. And you need to submit your reimbursements no later than 11/30/21. Please remember to send those directly to gmo@bjc.org, and you can also send a courtesy copy. It has come in handy if you send it to invoices@swillhope.org. We have just a little org box there where we just keep them there, and in case someone goes, hey, do you still have a copy of that? They can reach out to me. They don't have to reach out to Sarah directly, and I can provide that back to you guys. So hopefully everyone has spent. I know we had some last minute changes or executions of some pretty big ticket items, which is great, because that does spend up that money, and hopefully it'll all go to a great use. I know Eric, they just spent over at Anderson, just spent, I think, was it $59,000 on a patient simulation mannequin, which again will be a great resource to the coalition. That means we'll have a more inpatient style mannequin and Eric, if you want, please stop me and let me know that can provide you all kind of simulations with patient care, I guess all the way up to like some form of traumas, and then we have our kind of durable Tammy and Tommy mannequins that our REMERT team kind of manages, but are great for MCI training, etc., because they are, built for trauma and give you tons of feedback. So those are 3 quality mannequins. I'm talking right there around, I think that's around $180,000 worth of electronics. And I'm not counting the manpower and education it takes to run those. I'm just talking strictly as pieces of equipment that are there for your benefit as a region. So If you ever need to use any of these items, specifically those ones that are managed by Remart, you can always reach out to myself directly or anyone on my team, Lee, Mike, or Eric, and we can help you out so you can integrate it into your own localized training. But once we get Eric's on board as well, we'll just have that much more capability here in the region. All right, just a reminder, the Coalition Surge Estimator tool, if you have not, I think at the time, Scott, correct me if I'm wrong, I think we only had 3 or 4 responses. The deadline is November 30th, so this month. And again, those, I don't think they should have changed much from your last ones, and you all should have access to those. You can download them here and access those files. Take a look at it. If they are correct, just send it right back to Scott, and make sure you courtesy copy the or send it to the rhcc@swohope.org and courtesy copy Scott Klosterman. We'll get those consolidated so we can get those uploaded and back up into the Coalition assessment tool. That's one of my reporting requirements as well. So please knock that out as soon as possible. Definitely before the 30th, but we'd like to get them sooner rather than later. I think we got 4 at the most, and we can actually knock this out in like 15 minutes, to be honest. Scott, did you have anything to add?
I only had 4 responses.
I'm sorry, you came in broken, Scott. Can you say that one more time?
As of yesterday, we only had 4 responses.
Okay, got it. Thank you. Okay, moving on. HVA, another reminder, because November 15th is kind of the deadline where we wanted to have those. Lee, how many responses do you recall we got back total?
8 or 9. I'd have to go back and look exactly. Less than 10.
So as a reminder, we talked about knowing or not knowing the eventuality of SIMP. So we've asked you guys to complete your HVA through the Kaiser Permanente tool. Now I will say this, the tool that we provided, we got a lot of mixed reviews with coming back to the tool. I know a lot of folks are familiar with it, but some folks either didn't use this exact tool and made their own version of it, changed some words here and there, added some things. So that didn't help with the exact consolidation of what we do have. We worked through it, but again, we recommend for those who have not submitted, please use the version that we have here on this link. So as the information will be consolidated a little easier. So we had to go through some hoops to get it all consolidated. So this is kind of where we're at right now, okay, with regard to the HVA and the prioritization of those risks. As you can see, Liquid made a surprise move up to the very top, epidemic or pandemic. I wonder why. That in years previous, it was somewhere in the lower third of our HVA, and now it's as high as 1. We just redid ours here at Memorial, and it is our 2nd or 3rd. I can't recall off the top of my head when, again, it was at the very close to the very bottom, obviously because of going through COVID. So we are making do with what we have. So we are getting the information in. However, it can be a little easier. So please use the link that we've provided and get them in by the 15th. And as a reminder to those of you who do have subawards, this is a requirement of the subaward that you do in HVA and provide us a copy. So if you have not done so or participate in the HVA process, and this is a mechanism by which you can participate. So please send those in. I think I probably have this in from the MITEP, so we're going to kind of skip over that. We don't have anything truly to go with there. So I'm going to open the floor for any discussion from across Coalition. Anyone have anything they'd like brought up before I provide any additional information?
Hey, Phil, it's Eric. Perham, that is. I gotta identify myself. Actually, going back to the MITEP just for everybody that's out there. One, again, thank you for those who did participate. But the other thing again is as we are looking at, now you got the HVA kind of established, looking at courses and training that kind of answer the risk that we see out there. So again, we got you saw how the grant is kind of for the no cost extension is done, but we got other grant cycles that we can start looking at training and bringing stuff in based off of your, what you consider to be something that needs to be answered based off your risk from the HVA. So please, if you got training that just comes to mind, shoot me an email or Lee, so we can kind of start putting a more robust MITEP together to help, with the things that make the region a little bit stronger. So thanks, Phil. That's all I got.
No problem. Thank you, Eric. Okay. A few upcoming events that we got. We do have two more decon courses scheduled. We've completed 4 so far. Those have went fairly well. It is kind of a heavy load when we go out to the field and have to take a lot of stuff out. So we're trying to figure out ways to make that as smooth as a process for when we do those kind of mobile training teams. And what that may kind of, I don't want to say infer, but what may be the result of trying to make it a little smoother is that we may have to ask whoever the host is, whatever the host organization, that they have maybe a few more things available. So we're going to try to put together like a checklist of things just to make sure that we're good to go prior to getting there. But those classes have gone well. These next 2 classes that we have on the schedule, they are posted in Member Planet, so you can get access to them. And it's 12/8 and 2/9 next year. So one in about a little over 30 days here at Memorial Hospital, and then the second one in February. We will still, if you would like, our goal is to have at least 6 of them here. And if we can do 4 to 6 on the road, we will do those. So if you are trying to plan for maybe early spring or something like that, get us those dates so we can, work with Lee and we will get those dates squared away and try to make sure we're meeting the demand. But again, very happy to see that we're back with the program going, and hopefully we'll get more and more folks trained. Again, another reminder, HVA completion no later than 15 November, Coalition Surge Estimator Tool no later than 30 November, and plan review. So I've asked everyone to provide comments. So the last 3 meetings, we've talked about plan review, and the plans are out there on the drive for everyone to access. If you have comments, recommendations, suggestions, this is your opportunity to put those in motion now. So I'd like to have any of those comments back to us by 15 November. If we don't have any more comments, the goal will be to provide you just an update of what has changed, and those changes will be minor. One of the things that we talked about a few months ago was extracting the HVA from the primary portion of the plan and putting it into its own kind of addendum or annex, which we'll do. We kind of started that with just our own internal one as Memorial Hospital, and we'll just extract what we do have in the EOP currently and put that into a regional annex of the EOP. It'll save that annex about maybe 10 to 20 pages, but it'll just go into another one. So that's one of the major changes, and we'll cover some of the other changes. The goal will be to look for some form of unanimous consent on the plan's status as to where they are. So voting on those and saying, hey, this is where we're going to move forward, and then using those as we go forward. We have a few ideas on some training and exercises to kind of help us start to move out of the COVID day-to-day style training, or not style of training, but the COVID kind of fog that we kind of have and get us back to a few things that are non-COVID related. One of those of which is the coalition surge test. We've kind of talked about that in the past. It has been, we've done it, I think we've done it 2 or 3 times so far. And now the coalition surge test has changed and they call it the MRSE. And it's just another surge exercise. Very similar, but gives us a little more latitude in what we can or cannot do. So we'll be briefing that next month and looking for potential hosts or ideas on how we want to run it. I think we have a few ideas we roundtabled yesterday, so hopefully you'll find those appealing and we can kind of move forward because that is still a requirement. It's weird that the dates are a little bit off, but it's a requirement for this fiscal year 22. But all of the guides and support material aren't even done yet. So we got to kind of work with it as is. And so we're kind of targeting, at least right now, looking at a spring event to conduct the exercise. So again, the ICISF training, the crisis intervention training there, 11:15, as Mike said, online, 7 slots still available. And then the National Healthcare Coalition Preparedness Conference is still going on, although we're not attending it this year. We are kind of banned from travel, so we won't be attending that this year. Maybe some of you will, but we're not. Any last minute alibis, questions, concerns for anyone from the group? Okay, hearing none, we'll adjourn this meeting here, and this will be posted to the YouTube page. Uh-oh, Helen, I see you just jumped on. Did you have something? Maybe not.
No, I just wanted to say, Phil, I've been on the whole time, but I missed roll call, so I've been here.
Okay, no problem. Thank you so much, Helen.
Thank you. Bye, guys.
Take care. All right, we're going to end the meeting here. Again, this will be posted to the YouTube channel in probably about an hour or 2. So take care.